Hello and welcome everyone. This is the webinar, COVID-19 Conservation and Combating Wildlife Trafficking, Identifying New Opportunities for Practical Cross-Sector Collaboration. My name is Jason Gerard. I'm an associate in Tetra Tech's Environment and Natural Resources sector, and I will be serving as today's moderator throughout the panel discussion. First off, I'd like to advise everyone that we will be recording today's webinar so that we can share it afterwards. It should be an exciting discussion today. We have over 100 people in the audience, and of the over 200 people registered represent over 40 countries. It reflects the enthusiasm for this topic across many different sectors and represents a broad array of organizations, including USAID and other USG agencies, many different implementing partners, non-governmental organizations, academia, research organizations, and other independent experts. Why don't we go ahead to the next slide, please? I'd like to briefly introduce our panel of experts that bring their deep experience and thought leadership to today's discussion from various sectors, including conservation, veterinary and health sciences, and communications. First, we have Michael Balinga, who is based in Ghana and is the Senior Biodiversity Conservation Specialist for the USAID West Africa Biodiversity and Climate Change Project. He coordinates support to the ECOWAS Commission and its member states in fighting wildlife crime and conserving endangered biodiversity. Michael brings over 20 years of experience in forestry and wildlife conservation from the Congo Basin and Upper Guinea rainforests and the West African Sahel. Dr. James Desmond is a wildlife veterinarian and expert consultant based in Monrovia, Liberia, who specializes in emerging disease surveillance, the illegal wildlife trade, and the One Health approach. Jim is a contributing expert for the EcoHealth Alliance, tasked with disease surveillance and wildlife, a co-founder of Liberia Chimpanzee Rescue and Protection, and the former Liberia country coordinator for the USAID Predict project. Next, we have Thuy Huang, who is the country director for Wildlife Conservation Society in Vietnam, a USAID Saving Species partner. Thuy, based in Hanoi, has extensive experience in her native Vietnam and greater Southeast Asia, working across conservation and human and animal health sectors on issues such as the prevention of avian influenza, reducing risks of emerging infectious diseases, and fighting illegal wildlife farming. Gail Burgess is the Senior Behavior Change Coordinator for Trafficking, also a USAID Saving Species partner. She is based in Cambridge in the UK at Traffick's headquarters, where she leads social and behavioral change communication initiatives, applying behavioral science for conservation impact to combat wildlife crime and promote sustainable and responsible consumption of wildlife products. And last, Laurel Nemi, who is a wildlife forensics expert and author of Animal Investigators, How the World's First Wildlife Forensics Lab is Solving Crimes and Saving Endangered Species. She's a regular contributor to National Geographic, Manga Bay, and others. Laurel has worked as an expert consultant for the US Treasury Department, USAID, the World Bank, and various NGOs, including the Nature Conservancy and World Wildlife Fund. She's based in Vermont in the United States. Next slide, please. Once I finish introducing the webinar, we'll start with Michael's presentation, followed by Jim, then Thuy, Gail, and wrapping up with Laurel, who will help us to synthesize the discussion and transition us to the question and answer phase, which will last about 25 minutes. Before we start, let me share a couple of reminders and tips about the webinar. Again, as a reminder, the presentation is being recorded so that it can be shared afterwards. All audience members are muted for the duration of the event. However, questions are encouraged. Please feel free to submit your questions throughout the event by using the questions tab on the control panel on the right side of your screen, which is opened by a small red arrow. Next slide. Okay, just to provide a little bit of context and introduction to our webinar today. Obviously, many of you already know it's been well documented that COVID-19 and many other pandemics come from zoonotic transmission. What is perhaps less well known, but is becoming increasingly publicized, is the connection between zoonotic disease transfer and the biodiversity threats, conservation, and forest and wildlife management issues that many of us are already working on. Many of you have probably seen or read some of the numerous articles, papers, webinars, and other types of media recently addressing these linkages that have surfaced in the last few months since the COVID-19 crisis began. Just this weekend, in fact, the New York Times Magazine published a feature article that presented these linkages between forest degradation, habitat fragmentation, agricultural expansion, urbanization, and wildlife trafficking in a very compelling way. And we shared a quote from there, which was sort of one of the opening quotes in that article. So we'll share that and several other helpful technical resources after the presentation. I'd like to start off by acknowledging the thought leadership and numerous scientific and technical contributions that many organizations and experts, including some represented here today, have already made toward helping to better understand this complex set of issues. What we're really trying to do today is focus more on implementation. We want to leverage that ongoing important conversation happening in the media and across the international development community to identify some actionable steps to coordinate efforts within and across international development sectors, highlight the role of conservation actions in preventing zoonotic disease, and then create awareness of entry points for partnerships to help mitigate zoonotic risks. So first off, I'm going to hand it off to Michael Balinga, who's going to start off his remarks about titled Breaking One Hand, because one hand cannot tie a bundle, breaking silos and improving coordination. Again, Michael's joining us from Ghana on the West Africa Biodiversity and Climate Change Project. Thank you, Michael. Go ahead.
Thank you, Jason, and good afternoon to everyone who is listening. I joined Tetra Tech in August 2015, and my first posting was to Freetown, Sierra Leone in West Africa. Now, I had worked in Sierra Leone before at the start of the Ebola epidemic, and now I was posted back to Sierra Leone just when the Ebola epidemic was about to end. And what struck me were all the hygiene measures that had been put in place that were being observed by the general public, but even more so, the coordination that had been set up at the level of State House in the form of a task force. Moving a few years forward, and we now face the coronavirus pandemic, I look back at the situation in Freetown, and I noticed that prior to this coronavirus epidemic, a lot of the hygiene measures that were in place at the end of the Ebola epidemic were no longer in place. I wonder whether the coordination that had been set up was also functional just at the start of the coronavirus pandemic. I remember that in Côte d'Ivoire, for example, because of the Ebola scare, bushmeat hunting and eating had been banned. As we speak, and just before COVID-19, bushmeat was back on the tables, it was back in the markets, and we were pretty much back to the same situation as prior to the Ebola epidemic. And so it asks me the question of what did we learn from the Ebola epidemic in West Africa? What did we learn globally? Did we remember that we need to coordinate across sectors? Did we remember to keep the best practices going? And I'm not sure to what extent we did that. So I'll move to my first slide for this presentation to explain that it is important for us to coordinate our response to public health challenges. I keep in mind what Jason just reminded us, that threats to biodiversity are directly linked to public health issues such as zoonotic diseases. I call those environmental crime, and they could be all the different things from deforestation, illegal harvesting of wood, illegal harvesting of animals, etc. So we have these problems that the forestry sector is trying to address, the ones that the wildlife specialists are trying to address, and now we have the health sector trying to address coronavirus and a host of other zoonotic diseases. What is the common factor? It is that we have a problem which is connected, which cuts across all these sectors. But we are not sure that the way the response is organized takes into consideration the inputs from all these different sectors. Do we have the forestry, the wildlife, the health, the security people talking to each other as we try to find solutions? On the contrary, what we often notice is a siloed approach to addressing problems within each sector. So as a wildlife specialist, I work with people and we try to solve the problems of wildlife crime on our own. We have a saying that one hand cannot tie a bundle. And so what do we need to do? We need to break those silos. And what I would like to try to do is to show how examples of the work that the USAID program, West Africa Biodiversity and Climate Change, is doing in West Africa that could help. One of the things we are looking at is breaking silos between the wildlife sector, the forestry sector, and related sectors, security and now health, because silos exist at different scales and across sectors. So at the global scale, the conventions on biodiversity, on trading endangered species, may not be hearing what is happening at the local community level. Likewise, the World Health Organization may not have all the information and all the contributions that the CPD or CITES could make into addressing the zoonotic disease problems. What we have done over the last 3.5 years in West Africa is to support the ECOWAS Commission to develop a coordinated strategy for combating wildlife crime. And we started by doing an assessment of these biodiversity threats in 13 out of the 15 ECOWAS member states. We defined the regional priorities based on this threats assessment, and that led to the member states of ECOWAS developing a strategy for combating wildlife crime. Now, this strategy has just been finalized in the month of June 2020. And one of the interesting elements is that the vision now integrates an element of zoonotic diseases. So the integration is beginning between the wildlife sector, the security sector, and the health sector through this strategy. So we are trying to learn from the experiences we have had. I want to situate this strategy within the vertical structure or scale structure of global conventions, regional strategies that inform national policies and implementation. And I'll come back to that in my recommendations. But this is one of the cases where we have learned how to global. And we feel that there are examples here that we can use in addressing the coronavirus 19 pandemic. I'll move on to my next slide, just to be able to share another example on the work we have been doing, which tells us that beyond the data sharing, the shared vision, and the implementation frameworks that we learned about in developing our wildlife crime strategy for West Africa, there are other elements that we need to integrate or bring to the table. And these include awareness raising, capacity strengthening, and building regional networks. We train judges and prosecutors across countries in West Africa. And we first tried this in 2016, working with the US Department of Justice, with the FBI and the United Nations Office for Drugs and Crimes. What we did was train a number of judges and prosecutors, and we ran a training in 2016, repeated it in 2017, but we created WhatsApp groups that allowed these judges and prosecutors to talk to each other. And then we produced a toolkit from the experiences we had gotten. And we now use these toolkits over the last 2 years, 2019 and this year, to train judges and prosecutors across the 15 ECOWAS member states. We are seeing how these WhatsApp groups are helping the judges share experience with the prosecutors. We're seeing how they're sharing experience across countries. We are seeing how they are using contacts of other members of the WhatsApp groups to address problems that cross borders. And so what we are learning is that if you provide the right awareness to these judiciary sector people about environmental crime, and you strengthen their capacity, and you build networks for them, they can more effectively address challenges which initially were environmental sector challenges. And we feel that that approach can also be applied to addressing health sector issues or even other sectors. So we've talked about the regional scale, but looking at the national level, we also worked with the government of Liberia to facilitate the creation of a national species working group. It's some sort of task force. It's a platform for sharing information and making decisions with NGOs, conservation institutions, universities, and the Forest Development Authority of Liberia. They meet regularly, they exchange information, they collaborate with the judiciary and the police. And over the 2 to 3 years that they have existed, we are seeing tangible enforcement results emerging. The seizure of chimpanzees that were being taken into the pet trade, but also the seizure a few months ago of several bags of pangolin scales that came into the country from Guinea. So we see that when we designed this task force, it did not have the health sector. With the advent of the coronavirus pandemic, we are learning that we could have integrated the health sector into this task force. And I think it's not too late. It's something that can still be done. But we have seen how providing data to government, facilitating communication amongst institutions and coordination has helped to address the wildlife crime issues in Liberia. And we feel that this same approach could be used. I will discuss this in my last slide, where we can learn that to be able to integrate across sectors, we need to start by looking at all these sectors. We have the environment sector and the health sector that can integrate on issues of zoonosis, for example. The environment sector and the judiciary can integrate on issues of trafficking, and perhaps all of them can look together at how indigenous knowledge can inform the decisions that are made at the global scale, and can agree that ultimately what we seek is to ensure human resilience and ecosystem. Because we can see how each of them can integrate at varying levels. So across these sectors, we need to identify those points of intersection, integrating across scales. So what is being discussed by World Health Organization? Is it getting down to the communities in the villages in Sierra Leone, in Guinea, in Cambodia, wherever that is? Are they getting this feedback? Are the voices being heard at the global scale? And what mechanisms can permit their voices to climb up to the regional scale and the global scale? When the CITES Convention is discussing restrictions to trade in wildlife or wildlife animal parts, how does this trickle down to the communities who are actually in contact with the animals? And the knowledge that these communities have, the experiences they have, how do we make sure that those are captured when we discuss at the ECOWAS level, at African Union level, or at the global level? So basically what we would like to say as a conclusion to these remarks is that we already have frameworks in place that we can use. We have the CITES Convention. But as the former director of CITES said, we need to create or bolster CITES to ensure that it can help to mitigate the risk of future pandemics. Why? Because if we address the threats to wildlife, we would be addressing the risk of contact with wildlife at the local level and making sure that there are less opportunities for zoonotic diseases to jump to human beings. So what we would like to recommend at this point is that the CITES Convention should create a working group to address zoonotic diseases, which at the moment are not addressed by CITES. But we also need to make sure that there is a global task force set up to coordinate across sectoral policies between CITES, between the Convention on Biodiversity, the World Health Organization, the UNODC, World Bank, etc., that can deal with the links between biodiversity, health, security, and perhaps other elements. And we can make sure that we build on the experiences that I have just described at the regional level and at the national level to create task forces at regional scale, but also to create task forces at national scale. These task forces should integrate representatives of all these different sectors that we can see on the Venn diagram to the left of our screens, and make sure that they supervise the development of integrated responses and strategies, not just to the wildlife crime issues or environmental crime issues, but also to health issues, to economic issues, and whatever other issues are very important to our communities, to our governments, and to Earth as a whole. And beyond that, we need to make sure that there are specific financial mechanisms set up at the level of the World Bank, the African Development Bank or the Asian Development Bank, UNEP, with the GEF mechanism, DFID, USAID, all the other donors, to specifically target and support new and integrated initiatives that are based on cross-sector integration, but also that demonstrate integration across scales. We feel that by doing that, we will be able to improve on our capacity to prevent and to address issues such as zoonotic diseases that actually come into being because of the interaction of these different sectors. That is the takeaway message that I would like to share with you. Thank you for listening, and we welcome your comments and questions as we go on with this webinar. Thank you.
Thank you, Michael. Thank you, Michael. Very interesting content, and we look forward to hearing any comments or remarks or questions that the audience may have about that, as well as any of the other presenters at the end of the presentation portion, and at which point we'll start at the question and answer. I'm going to turn it over now to Dr. James Desmond, the wildlife veterinarian and researcher who's based in Liberia. Go ahead, Jim.
Thanks, Jason. And thanks for letting me be part of this webinar. It's really exciting to be able to talk about practical approaches to doing something about combating pandemics like the current coronavirus that's circulating around the world and affecting literally everyone in the world's life right now. So I'm going to talk about, since I'm a veterinarian and I've been working for EcoHealth Alliance and what we do at EcoHealth. I think you can go to the next slide because it'll be easier for me to explain. I'm going to be talking about what One Health is, what that means, and Michael's presentation was actually helpful because it will inform some of the stuff that I'll be talking about as well. So as Jason said, I was the country coordinator for a project called PREDICT, which was funded by USAID, and that was part of a larger program called the Emerging Pandemic Threats Program. And as the name implies, the goal of that program was to try and understand where these emerging diseases are coming from. So if you look at this graphic at the top, you'll see a sort of the green sine wave at the bottom. That represents viruses circulating in the wild, and any given time, these diseases are always circulating. And so, like with what happened right now with this coronavirus, we think it came from a bat. It it came in contact with a person at some point, or maybe through an amplification host, and then spilled over into the human population and caused this global pandemic. So the idea behind the Emerging Pandemic Threats Program, which as we go on, I'll refer to that as the EPT program, and PREDICT, which is a part of that, is to try and understand what's out there, because they're circulating all the time, and then mitigate that risk and try and flatten the curve before there's actually a curve. So if you look at the graphic, you can see there's a big curve, and then if we're doing the right job and doing early detection and knowing what diseases are out there and which ones might impact human public health, then we might be able to prevent it getting into the human population and causing all this destruction that it's caused, that like what's happened with this current pandemic. Now, this whole idea about preventing these diseases from getting in the human population is part of a larger idea, really, called the One Health approach. And One Health, as the name again implies, it's about how all life and all health, and therefore all health, is interconnected. And as part of the EPT program, USAID was funding a sub-project called the Preparedness and Response Program. And the idea of that was set up One Health platforms or One Health structures within governments to try and build a multi-sectoral approach to combat these public health threats that are coming from wildlife and other domestic animals. So in Liberia is really interesting because, obviously with the Ebola epidemic, the people in Liberia, it was very devastating for both individuals and families in the country itself, and also the economy of the country. And people here realized that, the normal public way of doing public health wasn't really good enough. So the government itself adopted this idea of the One Health approach. And I think you can go to the next slide and it'll give a better idea of what I mean by One Health in terms of some Venn diagrams. So what USA did was they funded a bunch of workshops to get the different sectors. So when Michael was talking about silos, what they were trying to do is actually break down those silos. And I can tell you from living in Liberia and being involved in this process from the beginning, it's had a really dramatic impact on how people approach public health in Liberia. And I think the most dramatic way that it's helped improve people's understanding of public health and where these diseases come from is by setting up this platform. And so the way the platform works is there's a steering committee, and there's a technical committee below that, and then below that there's several technical working groups. And the technical working groups meet monthly. And what that's done is you have people from the Ministry of Agriculture, the Ministry of Health, the National Public Health Institute, different private sector groups, NGOs like our group, Liberia Chimpanzee Rescue and Eco Health Alliance, all these different people to get together in a room on a monthly basis. And the thing that I guess I didn't expect when we started this process, because I've been thinking about and working on One Health for a long time, and what we talk about, a lot of times people talk about operationalizing One Health and like, what does that mean? What does that look like? Well, what I realized is what it looks like is actually when people get in a room together and they're meeting monthly and they're working through the process of building these systems, they actually build really strong relationships. So you have personal relationships between people from the Ministry of Health and the Ministry of Agriculture and the National Public Health Institute and the different NGOs. So when there is a problem that happens somewhere in the country, say there's a disease there's a foot and mouth disease outbreak in hoofstock in part of the country, or there's a wildlife animal die-off, say in the ocean somewhere or in the forest somewhere. These people who are meeting every week, they already know each other, and they very quickly are able to allocate resources and figure out a way, set up an ad hoc task force, and then send a team out to investigate what's happening. And like I said, I didn't really, before we started this whole process, I didn't really realize that the outcome was going to be really based on communication and relationships. Now, I think you go to the next slide and we can talk about some of the challenges with setting up these types of systems. But at the end of the day, you know, we always worry about resources and money and how we're going to fund things. But at the end of the day, once you've built these relationships, you know, when we go to these meetings every month, you know, there aren't any people show up to the meetings because they know it's important. There's not, you know, there's not per diems or honorariums involved. People show up because it's important. And I think that's what, for me, has come out of it, and is it's a real success story, actually, in terms of you know, USAID funding or donor funding something, and then having it actually sustain itself after the funding is no longer part of that. So I think, you know, every country has a different context. So Liberia is one specific case, and the way we did it here was setting it up as a, you know, from the top down, so putting it into the government, and then people in the government adopting it. And we're very fortunate that people in the health sector, you know, really champion the idea. A lot of times, you know, usually the human health sector has a lot more money, so sometimes it doesn't. They don't try and help out the other sectors. That happens in a lot of different countries, but I'm just talking about with Liberia specifically. It might not be the same in other countries. So one of the challenges is finding someone from within the government or within that system who's going to champion the idea. And of course, you need some funding to set these things up. Liberia itself, some of the challenges we faced here was because of the history of the country with the civil strife that happened for a whole generation. There's a huge lack of expertise in certain areas in the sciences, so capacity building has been really important. That won't be the case everywhere, but it certainly was here. And then initially, you need some operational costs to fund the actual functioning of these systems at the beginning. But over time, you can have governments or different groups who are involved to put in to tackle those costs. So I think, you know, I can only speak for Liberia and some of the few other places I've worked, so I don't know what it'll be like everywhere. But certainly having individuals who champion the idea and pushing it through and are passionate about it are definitely going to help it get to the end. I think we can go to the next slide. There's a bunch of so this is some of my colleagues at EcoHealth Alliance published in conjunction with the World Bank published a manual for One Health, sort of the best practices associated with setting up either One Health platforms or doing One Health type work. Like I said, it's not a one size fits all approach. So but the important thing about it is it does incorporate all these different disciplines, and it really does use a multi-sectoral approach to sort of tackle different problems. And I think we can go to the last slide, because I want to switch over to some of the other work that's going on here in Liberia that's related, and also related to some of the things that Michael was talking about. Because at the same time, as Jason mentioned, I'm also the co-director of a group called Liberia Chimpanzee Rescue and Protection. And my wife and I started this several years ago in response to what we saw was some of the victims of the bushmeat trade. So these young chimpanzees that were orphaned from the bushmeat trade. And at the same time so this is what's so interesting about Liberia is we had people adopting this One Health approach idea, and it was sort of a top-down structure. It was being built that way. Well, at the same time, when we first arrived, there was the species working groups that were being developed. And so the species working group started with a sort of biomonitoring. It was led by the FDA and some of the great NGOs that are working here, like Wild Chimpanzee Foundation and FFI and Conservation International. So there's a biomonitoring group to try and build standards to do biomonitoring in wildlife and in the forest here in Liberia. But at the same time, there was also a law enforcement subcommittee that was formed. And so the law enforcement subcommittee has been really instrumental in carrying out a lot of the tasks that Michael was talking about in his talk. So, you know, getting the Forestry Development Authority and the law enforcement authorities together, along with a lot of the NGOs, to try and tackle the problem of sort of the illegal wildlife trade. And so a lot of the recommendations was that Michael made. I'm also going to make the same thing. Is like, even though I've been working in both different fields with public health and diseases, and also on the law enforcement side through the Liberia Chimpanzee Rescue, we haven't really brought those two together, but that's sort of what we're hoping to do in the future with some of the, in light of what's happening with the coronavirus. It's very important for people to see that, you know, a lot of times I think people think, well, before now, people would think, well, you know, conservation and wildlife trade is over here and public health is over here, when in fact they're not. There's this link together with that there is a risk, there's a health security risk, and there's also a risk to what's happening with the wildlife themselves through the wildlife trade. And that's sort of the nexus where these two things come together. And so I think there's different ways that this can happen. So in this case, with the species working group, it was sort of a bottom up, whereas with the One Health, it was a top down development of these ideas. And so either way it can happen. And I think the next step for both One Health, with these One Health platform, and also with the sort of the wildlife crime task force that's been developed here in Liberia, is to take these models that are right now sort of central and national, and then expand them out to like the county level in Liberia. And these models, like Michael said, could be used in other places as well and adapted to the specific context in those countries. Because I think without combining the two, I think by combining the two, we're going to have a better chance of combating some of these issues, especially public health related to wildlife trade. So thank you very much. And I'm looking forward to any questions that people have later on in the Q&A section.
Thanks, Jim. Much appreciated. Very interesting, and we look forward to continuing the conversation with you after in the Q&A. Tui, you're up. Again, Tui Huang is the WCS, Wildlife Conservation Society Country Director in Vietnam, who works with USAID Saving Species, among many other activities there. Go ahead, Tui.
Thank you, Jason. Good morning, good afternoon, good evening, everyone. I'm Thủy, working Vietnamese and working in Vietnam. I would like to bring you to some context now, a case study in Vietnam. So as you may know, Vietnam has a border with Laos, Cambodia, and China, with big seaport, airline, and land route, so that make our country as a transit for transporting wildlife trade. We also a country of destination using those wildlife animal, use it as a gift, use it to show their social status, or just consume it for the health and medicinal purposes. So that really facilitates the illegal wildlife trade, but also to increase the demand for wildlife. So the government of Vietnam signed to the CITES from 1994. So the government really commit to fight against illegal wildlife trade and translate into action of improving our legal framework, including different degree, different resolution, different circular, and more important is to improve, to revise the Penal Code, 2015 Penal Code that was finished in 2017. It takes effect from January 1st, 2018, to double the penalty, so to 15 years. So we do hope that with the stronger penalty that can deter on subsequent trade. The saving species, the USAID saving species has been providing support to update and have a training and workshop to update on the law enforcement on this new and updated legal framework for better enforcement of illegal wildlife trade. So to respond to COVID-19, the government of Vietnam has been working through promoting and promulgating more decree, more directive, including those in January on prohibition of wildlife trade. The Prime Minister of Vietnam also appointed the Ministry of Agriculture and Rural Development to coordinate with our related ministry to develop a directive to prohibit trade and consumption of wildlife. However, it has been delayed and it is now with the Office of the Government. So we do hope that with the new directive, so that will set a more foundation for subsequent legal framework improvement. So in the next few minutes, I would like to share with you the past experience, lesson learned from the government of Vietnam in responding to avian influenza and emerging infectious disease in early 2003 and 2002 until 2015, 14, 15. And how the government was working at that time. So the three things that I would like to recognize the government of Vietnam at that time is the One Health approach that would go with the establishment of the National Steering Committee from the national down to the commune level with the representation of both Ministry of Health and Ministry of Agriculture and Rural Development. The second thing is about the community-based surveillance that really help report early, detect early, and respond early, timely to those disease, avian influenza at that time, where the community people can report to either human health for human case or to the animal health for animal case. So that can bring them into more of early decision making to contain the disease. And the third thing I would like to emphasize is the behavior change intervention, where at that time we were really targeting to different nodes of the poultry supply chain, including farmers, poultry farmers, slaughterers. They are working in those either slaughterhouse or centralized slaughterhouse, and market vendor in those live bird market. So that's really the lesson learned from the past. And during the COVID-19 pandemic, we also acknowledge the effort of the government of Vietnam in early detection, timely containment, also treatment of COVID-19. So by now, after 2-3 months of in the pandemic, we have only 353 cases of COVID-19. So we can applaud the effort of the government, really high commitment for the health of people in Vietnam. However, we can do more, and with more coordinated effort to prevent future infectious disease and pandemic, with gearing towards more of the public health and with the coordination of different agencies. So from that, I would like to change to move to challenge, saying if we do a better job, what will be the challenge that we will face? So you want me to the next slide? Yeah, thank you. So, so as I said, the Vietnam signed the CITES in 1994. So the commitment is high, political will is improving, and the government is really working to improve the legal framework. However, there's still gaps and loopholes in that we can improve, including there's no penalty on consuming wild meat. Either that is the administrative fine, like you have to pay, or criminalize those acts of consumption. And other point in the penal code can be approved, including penalty on storing, transporting, and trading the product of Group 1 or Annex 1 of the CITES. Other loophole that we can see in the 2015 veterinary law and 2007 law on prevention and control of infectious disease they both cover some zoonotic disease, but nothing specific about those zoonotic with wildlife-related origins. So that's where we are with the legal framework and the loophole that we can work together. I also have to emphasize that there's insufficient collaboration and data sharing for early detection and decision making between the human health, animal health, and the law enforcement officer. So when I say law enforcement forces, that including police, forest protection, customs, prosecutor, and judge, they are in charge of all the illegal wildlife trade and other environmental crime. So lacking those collaboration also lead to like no sharing information or even no integration of those new and update into the education system, where in the university wildlife crime is new, in even the police university or the agriculture university where the zoonotic disease are new as well. In the forest protection university, no, there's nothing about wildlife crime. So, so that's very important that we need not only the collaboration, but also data sharing for decision making. There's also a question on a clear role and coordination between the different ministry, including the Ministry of Health, Ministry of Agriculture and Rural Development, and other ministry like Ministry of Commerce and Industry, who are in charge of doing market inspection in those live market. Live animal market, or monitoring food safety, or farming biosecurity or hygiene condition in those farms, wildlife surveillance. So that's where we need to see more of the coordination between these government agency. We do have some guideline, some circular, but there's still gaps on handling confiscated wildlife and violation. They focus more on the process and the role of different agency, but not about the risk of zoonotic disease to human, to those enforcement officer and to animal. So we really need those standard operating protocol that can guide step by step for law enforcement officer who are not trained in animal health, who are not trained on wildlife disease, but they are the one who are first really exposed to animal in those confiscated situation. So that's very important to work together between animal health, human health, and law enforcement. So that lead to a recommendation at the country level. Recommendations. You want to move to the next slide, please? So the recommendation I would go for is still One Health approach, but encourage the participation and important role of law enforcement officer forces, because they are the one who work on the illegal fighting illegal wildlife trade, where they are not into the picture of One Health yet. And in order to do a better job in the future of preventing future pandemic, fighting against illegal wildlife trade, and for the best of conservation of animals in Vietnam, we immediately need to prohibit commercial trade and consumption of wildlife, especially those taxa with high risk, birds and mammals. We also need to put those action like seizures into more action of enforcement and judicial response. We need more prosecuted case and conviction. So seizures are good, arrests are good, but conviction and prosecution and conviction are very important to make sure those crime are in prison. We also need to tighten the regulation and oversight of commercial wildlife farms, where it's not only for the sake of the animal, but also the public health of people, and to prevent animal laundry. So that's where the farms can be a place for laundering illegal hunted, poached animal. We need to cooperate to improve the cooperation and coordination between public health, animal health, and law enforcement to prevent zoonotic disease, not only public health people in that picture. And the last one will be behavior change. I think the mass communication are good, but people need to act more and change their daily behavior of either wildlife consumption, but also even policymaker. They need to act, not only to talk. So, and also develop those protocol to reduce risk. And if we work on farms, then we need to work on livelihood alternatives as well for those farmers to make sure the well-being of those change. So that's the 5 recommendations at the country level that I would like to emphasize. And that really end of my presentation, and I'm sure you would have a more question, but I'm willing, and your question are always welcome, or even question for clarification are welcome as well.
Okay, thank you, Tui. I'd like to turn it over to Gail Burgess, coming to us from the UK, where she is the Senior Behavior Change Coordinator at Traffic, also a partner to USAID Saving Species. Gail, go ahead.
Great, thank you very much, Jason. Good day, everybody. Very nice to have an opportunity to speak with you today. I'm going to speak to you a little bit about the behavioural dimensions to COVID-19, conservation and counter wildlife trafficking. Next slide, please. So I'm going to start this presentation by focusing a little bit on the consumer end of wildlife supply chains. In particular, reflecting a little bit on some of the attitudinal and behavioural research that's been conducted by others and is published. I've got the links to the studies for those that would like to know more there. So on the left-hand side, the left-hand column, this data comes from a piece of research conducted by a research firm called GlobeScan for WWF, and it was published in April of this year. The research was a rapid assessment conducted in 5 markets in Asia. And I guess the key statistic that jumps out immediately from the top left-hand box is this 93% figure of people in the survey that indicated they were very likely or likely to support efforts by governments and health ministries to close all illegal and unregulated markets selling animals coming from the wild. And my first impression from reading this is sort of recognizing that, you know, I guess most people would agree to closing illegal markets. This data represents 4 territories in the study, so Hong Kong, Myanmar, Thailand, and Vietnam. And it's quite interesting when you dig into the data to see the differences in each of those markets around the mechanisms through which people would propose to support such action. So if you look very carefully at the bottom left figure, this is from Vietnam, where only 32% of people in fact said that they would stop visiting and buying in such markets. This is kind of overlaid as well by often there's a lot of misunderstanding about what wildlife markets really are. Often, you know, people that buy products such as wildlife from these markets, they're also going there to buy many other types of food. So you'll get fresh fruit and vegetables, flowers, seafood, dried goods, grocery products of various sorts. So interesting to kind of dig into the data a little bit. Another part of the study indicated there was a question to the entire sample that asked if the respondent or somebody they knew had bought from one of these markets in the past, and 9% of the sample said yes. And then a separate question when people were asked, would you be likely to buy from these markets in the future? Actually, 8% said they would. So there's a lot of need, I guess, to kind of dig into data such as this to understand people's attitudes and to explore in a little bit more detail, you know, what does this mean for how people are buying and where they're buying their protein from. So moving towards the right-hand side of the study, this was a study conducted in 60 markets by the global commercial research firm Kantar. They produced this barometer, again, publicly accessible information. In the SARS pandemic, one of the trends that we observed 2002 to 4 was this shift from protein being met from meat sources towards seafood. And it's interesting to see that in Kantar's study, consumers are telling them they're actually eating less meat and seafood on this occasion. But one of the key trends which is worth paying attention to in the bottom right figure there is this requirement for consumers to really be reassured that what the food and beverage and consumer goods they're buying is safe. And of course, that's not unexpected, but it reinforces the importance of action to demonstrate the traceability of all of the wildlife and other products in our supply chains. There are some examples. For example, Food and Agriculture Organization, FAO, has produced the Responsible Fish Trade Guidelines. This offers a good framework for action, but does need to be adapted and applied to other sectors. One of the other things that came out of a study by Nielsen, which doesn't feature on the slide here, when they surveyed consumers in China, 89% of the sample said that they were more likely to buy products online. And this has significant implications now for the volume of illegal wildlife trade that already occurs online, still ongoing. We still need to tackle that. And this presents new challenges and kind of gives us a new impetus through which to really get on top of that. So quite interesting and very important really to continue to monitor consumer change and just understand what does it mean when consumers express these sorts of attitudes. What does it actually mean for where they're adapting their buying behavior. So thank you. Next slide, please. Moving along to other parts of wildlife supply chains, we've heard some very compelling information already from previous presenters about the use of wild meat. In some of the data that's available, experts suggest that as many as 70 million people in Africa are acquiring protein through wild meat sources. So it's a very significant resource really for impoverished and rural communities around the world, and something that we really need to understand the changes that are happening as a result of COVID and in relation to wild meat offtake. Trafficking India produced this study earlier this month. There was a rapid assessment conducted on the reported poaching incidents, both pre and during lockdown. So in a study they conducted between the 10th of February and the 22nd of March, which was the pre-lockdown period in India, and then from the 23rd of March to the 3rd of May, which was the subsequent during lockdown period. There was a significant increase, more than doubling of poaching incidents that were reported in open source media. There were 88 incidents recorded in the lockdown period versus 35 in the pre-lockdown period. And when you dig into the data for this, it was remarkable to which the extent of the shift was really observed with relation to ungulates. So in the pre-lockdown period, 22% of the cases that had been recorded were relative to ungulate species, but in the lockdown period that had increased to 44% of the recorded incidents. And this is relevant in particular because ungulates traditionally are used as a source of nutrition. And if you look into some of the reasons why there might have been this surge in these types of poaching incidents, it's a combination of complex factors. There was significant mass migration from urban centres in India to rural communities as people moved out of cities. This was combined with unemployment due to the COVID lockdown situation, so people had to compensate for lost income sources. And while the law enforcement agencies in India prioritised action to tackle this issue, they were very proactive, they made it a priority. There was restricted mobility still in protected areas, and obviously they have additional pressures of dealing with COVID priorities as well as those around wildlife protection. So that it's a very interesting kind of factual evidence-based insight into how these types of pressures, how the situation with COVID and the restrictions are really driving some elements of poaching. In order to get on top of this, some of the recommendations would relate very much to those published in the document on the right that came out last year. This built on a decision that was adopted by the Convention on Biological Diversity in 2018 at their 14th Conference of the Parties. And it's decision 14.7, which looks at how to progress a sustainable wild meat sector. This document is very important reading. I would add at this particular moment in time, it's critical that additional resources and investment are put towards ensuring there's adequate livelihood strategies and sustainable sources of protein for people that are very heavily impacted by this. There are risks sometimes to alternatives to wild meat harvest. For example, in the Brazilian Amazon, there's estimates that around 50 million hectares were cleared for the beef industry there. And so there's a very complex set of issues that we need to get to grips with, and documents such as this by C4 and CBD offer a good initial reference point to progress that. Next slide, please. So moving more towards sort of the medicinal use of different species, obviously things like horseshoe bat feces in treatments is featured very prominently in a lot of the media that I've seen. And there's also been concern about the fact that bear bile is included in some of the treatments. Actually, it's often some of the more invisible trade, as we've called it here, where there are significant threats that we also need to be aware of. In the past 20 years, between 1998 and 2018, there was actually a threefold shift in the economic value and volume of trade in medicinal plants. There are around 60,000 species of medicinal plants in trade, and only 19% of those have been assessed against the extinction threat criteria that the IUCN Red List houses. More than half of those species are actually threatened, and with 60 to 90% of all medicinal plant species harvested in the wild, you know, there's a real need to get on top of what is the situation facing wild plant trade, and how can we rapidly ensure that this is sustainable. The reality is that medicinal plant species feature in the COVID-19 treatments in Asia, Africa, Europe, and South America and the US. If you look to China, for example, there are 10 traditional medicine formulations that are being recommended for COVID-19. There are 13 that are registered treatments, and of those, there's 125 medicinal plant species that are used for ingredients in that sector. So it's just one illustration of what actually is a very hidden element of wildlife trade supply chains and threats to these species. And this week is Fair Wild Week, so a very good reminder for us to get on top of that. Next slide, please. So we wanted to allow enough time for questions. I'm going to wrap it up here for now. I do very much hope, as did the other panelists, that we'll get the chance to explore a few more of these issues through the discussion. But I highly recommend anybody that would like to see resources in this area, some of the knowledge gaps and recommendations that we've identified should be prioritised for future. Please have a look at the COVID-19 Resource Centre. The links are there, and our wildlife trade, COVID-19 and zoonotic disease risk briefing paper. Any questions on any of that material, I'm very happy to speak further in the questions. Back to you, Jason. Thank you.
Thank you, Gail. That was great. Much appreciated. I'd like to transition now to Laurel. As I mentioned before, Laurel is a wildlife forensics expert and author of Animal Investigators and a regular contributor to National Geographic and Manga Bay, among many other publications. We're really glad to have her here today. She's going to be working with us to really help us wrap up the discussion and develop some synthesis and takeaway points of what we can talk about it, and then of course bridge that conversation to the question and answer section afterwards. Go ahead, Laurel.
Well, that was really interesting. I was jotting down notes, and so hopefully I can summarize some of these really interesting points. I think I heard a number of commonalities from the examples in Sierra Leone and Liberia and Ghana and Vietnam, which was a lot about, obviously, coordination. And what really struck me to start was this, what we learned from the situation with Ebola and the SARS, which was the importance of the coordination and the need to break those silos in reacting. And also that we don't forget those lessons learned. I mean, that was really striking that some of these, I think Michael had said that there was a ban on bushmeat initially and that it was back on the menu. And also Gail's point about wild meat being an important food source. And we really need to understand how people act to have a sustainable response to both this crisis, but also emerging crises. And so why break down these silos? Why do it? And I think from all these examples, we've seen that it's both to solve the issue, but also to continue and learn lessons so that we can get help faster, but that it's also not recreating solutions, that you're learning from what others have done, that you also don't feel alone in these solutions, but also to fine tune everything and better solve the issues. You get better data, you get a more complete picture. And like Jim's example about the earlier detection with surveillance and emerging diseases, and that graph with those those little signs, which is a lot of what you're seeing in the graphs with COVID currently, with that better detection earlier leads to better outcomes. And I think some of those elements that we kept hearing throughout all the presentations were understanding consumers, understanding indigenous knowledge as well, but also understanding across sectors with, from wildlife, health, security, economics, and the financial sectors. And then there were some really interesting examples, I think, about concrete examples and opportunities for coordination, whatever scale you're working at. And I think that was really interesting because the need to break silos at all the different scales, at the very local level, at the county level, at the national level, at the regional level, at the global level. And depending on where you're working, you can actually do something today across sectors, whether it's expanding. We heard a lot about how some of this was expanding existing structures like these species working groups that were already set up to include health and to include other sectors. We also heard some really interesting examples that I think almost everyone can implement today, which is after these trainings, like the training of the judges and prosecutors in West Africa, and creating that virtual WhatsApp group. And I think that was super powerful because a lot of times you do have these training sessions, and then afterwards people might keep in touch based on the participant list, but to go that extra step of setting up a mechanism, some sort of mechanism, and it can be very informal, a Facebook group, a WhatsApp group, and the implications for that, it seems like a minor thing, but actually we heard how that can actually have a huge impact, because that coordination, and this was another big point, was that coordination really depends on relationships, and that you can set up these structures, but what really makes them work is sort of knowing the people. And this is actually an opportunity right now, because we're moving so virtually because of this pandemic, to actually get a little bit more of that, and people that you normally wouldn't meet, like for me meeting these people on the panel and becoming friendly with them and knowing what they're doing. And so knowing who does what is really key, and creating these virtual groups, whether it's WhatsApp or continuing discussions and relationships, builds a trust, which, as we heard in the law enforcement arena, is actually vital to sharing information. And so that makes sense in other aspects too, is when you have information, who you share it with, how you share it. If you trust the person and trust that it's going to either get to the right place or be used in the right way, that goes a lot, that pushes the envelope much further on your willingness to share information, or just that it even crosses your mind that, oh yeah, I should tell so-and-so about this because they might be interested because of what they're working on. So I think those informal relationships really have this big impact. And so some of those mechanisms for coordination, I think another aspect, and I'm sure I'm not going to hit everything, is that, you can start really small with local groups of people that you know from a training session, or just sharing interests across countries, or with respect to one area, like species groups, can really go a long way toward addressing that compartmentalization. And that remote work tools can really help with that coordination. I think that also has driven down some of the cost of coordination with, a lot of times you're not going to use some of your budget to fund a sector that's not yours. And so the fact that you can do this in a much more cost-effective way. But I think the other point is that we kept hearing that it actually drives down costs of the solution and addressing and the implementation. And so I think a recognition of that is really key. And then I think the other thing is this has all been really important to identify some of those hidden threats. I think Gail was really hitting on it, and there's sort of two that really jumped out. One is that real recognition that wildlife markets and wild meat is an important source of protein. And so the focus has really been on closing illegal wildlife markets. But there's a reality based on the consumer data and the behavioral information we have, is that people are still going to frequent it. The moving to things online, that threat as well. And so the need for more, both a safe, traceable, sustainable supply, and that all people in that value chain need to be engaged. So, from animal husbandry, supply chain, stock management. So have a good idea of the social and behavioral changes. Another on the policy side and regulation has really focused on over-exploitation, but not necessarily taken into account some of these health concerns and maintaining that safe supply as well. And then the other sort of hidden threat that we heard a lot about was related to treatments, where we don't have a lot of information on a lot of the threats to all the species used in some of these treatments. And so, so just to highlight that, and the fact that there's a very potential for overexploitation of the wild flora for use in treatments, with it almost going unnoticed. And I think that that's really important to highlight. So I guess I've probably gone over, so I apologize, and I'll stop here to open it up. Throw it back to Jason.
Great, thank you, Laurel. That was really helpful, and I think hopefully it should spark some interesting conversation amongst the audience and the panelists. We've got a great set of questions that's still incoming, and my apologies in advance if I don't get to all of the questions. We've got about just under 20 minutes left, and so I will kind of start throwing them out there, and in some cases you may hear your question a little bit modified or compiled, and a number of questions are coming in that are similar to others, so we're doing our best to aggregate them where it makes most sense. One question, and maybe for, we could start off with Michael, but for others on the panel as well, it really relates back to this notion of the lessons forgotten rather than the lessons learned. And basically, the question is something along the lines of who can make sure that the lessons learned aren't forgotten? And then, of course, how do we do it? Michael, why don't you take a first stab at that? And if anyone else on the panel wants to jump in, feel free.
Thank you, Jason, and thanks to the person who asked this question. So who can make sure that these lessons are not forgotten? I think it depends on what scale we are talking about. And it's also a question of, first of all, who has the mandate and who has the interest. In terms of who has the mandate, I would say that definitely the institutions I mentioned at global level, the World Health Organization, the CITES Convention, the Convention on Biodiversity, and the UNODC, for instance, have that mandate at the global level. And that's why I thought that a task force is necessary at that level to ensure that these lessons are captured, are documented, and are put into policies. That's a bit of the how. Because if we don't only capture them, but we make sure that there are policies in place at the global level, but that these policies are also taken up at the level of the African Union or the whatever unions exist in Asia, in Latin America, etc. So at the regional level, these policies are put in place. Then they would force the government level or the national level to also make sure that they are coordinating, they are capturing these lessons, and they are using these lessons as we go forward. So first of all, it's the states, it's the government agencies who have that responsibility. And one way to do it would be to make sure that the policies that exist or that do not exist precisely are adapted, are revised, are established so that they provide the frameworks that we need. The other thing is making sure that other sectors can contribute. We have NGOs, so the civil society sector, that can do a great job in advocacy, in communication, awareness raising, and education. They have a very big role to play in making sure that whatever lessons are learned actually get communicated to the general public, and that the public is kept reminded about these lessons. So I'm sure there are many NGOs out there who are doing work in communication, in behavior change, for example. That's a challenge to you. There's something you can do, and you can work with the governments, you can work with other civil society organizations. So I think that's the first response to this question, and I'll let other panelists also chip in whatever ideas they have. Thank you.
Great, thank you, Michael. And I'm glad to move on to another question if no one wanted to provide any further answers to that one. Gail, perhaps a question for you, and then whoever else wants to address it, Tui as well, perhaps, about the wild meat sector. The question reads, the wild meat sector is also driven by the middle and high class consumers in many African countries, Zambia inclusive. The behavioral patterns and communications to this section of the population is important, notwithstanding the many benefit sharing issues that limit genuine local community involvement in natural resources management. Poaching is on the rise and is driven mainly by poverty in both rural and urban centers. Perhaps Gail and then Michael.
Yeah, thank you very much for that question. Yes, I mean, it is something that is also evident elsewhere beyond Africa, this kind of commercialization of some aspects of the trade. I mean, there are social and behaviour change initiatives already ongoing, both in Southeast Asia and Central Africa, trying to tackle this element of the trade. It's clearly a legal trade, dependent on which species you're looking at that are being sold. But elements of this are all covered in the CBD report that's trying to dig into a lot of the complexities around this. How do you disaggregate what is genuinely for subsistence and critical for rural livelihoods for people's protein needs versus something that's a bit more about the novelty and the uniqueness and the desire to have something rare. You know, there is evidence that some aspects of the demand for these products are specifically because they're rare and hard to acquire, which is you know, obviously quite tragic. So yeah, it's something that's handled quite nicely in the 219-page CBD report. We don't have time to get into it in depth today, but it's a good framework that I think needs to be rolled out beyond the region in which it was developed, which was C4, so Central Africa. Thank you.
That is a big concern. I think, you know, we see it here in Liberia. I've seen it with my work with EcoHealth. I've spent a lot of time also in Asia and China, in different parts of Asia, where you see the commercialization of wild meats. And I think it's, you know, if you see meat being sold in a market in Monrovia, you know, it's not subsistence. It's people getting it from the forest, and then it's being sold in town because people, you know, maybe people who now live in Monrovia, for example, the big city, you know, they grew up in the rural area. Now they're making money and they're maybe middle class, and they still like to eat that meat. I mean, eating food that you grow up with, I mean, we all do that, you know, it's like something that you're used to. So changing those behaviors, I think it's a real challenge, but it's something that needs to be tackled, because it's not only just the people in the forest. I think subsistence hunting, you know, is fine. You know, if someone's getting their protein source for their family and they live near the forest, that's fine. But once it starts going to someone going out and hunting to then sell to a middleman, to then sell to another person, or even farming, I don't know what Thuy's experience is in Vietnam, but I saw in China, there's a lot of wildlife farming in China, and what happens is, it's almost like a pyramid scheme where someone will be raising bamboo rats or porcupines or civets, and then they sell to a stock of a few animals to someone else because their neighbor sees that they're making money. And then what happens is, if people aren't doing good animal husbandry and their animals die, then they'll start sourcing to supplement their stock of animals. They'll go to the forest and then take them out of the forest. Or so, even though it might seem like, I've heard some people argue that, you know, doing testing in these areas where there is wildlife farming, where the wildlife farming is sort of part of the culture, it's probably only newly part of the culture. And some people say, well, we should be testing those animals, you know, because if they're going into the food chain, then at least we're understanding what diseases are there. But I think that ignores the risk of growing that industry, where then it has, even though it might seem like it's not having an impact on wildlife because the animals are farmed, I think there's a lot of supplementation from the wild that happens, at least in China, and I'm not sure about Vietnam, but I'm guessing the same thing kind of happens in other places. And so that's a real danger, I think, from a conservation perspective, but also from a disease perspective, because if you're supplementing animals from the wild to your own stock of animals, you know, that's a problem. Not to mention then what's happening with industrial agriculture with domestic animals, and then maybe that same type of thing happening with wildlife farming.
Thanks, Jim. Michael wanted to add something to this question as well. Go ahead, Michael.
Say that what we are looking at here may be an issue of two different scenarios. One scenario is that of community members living near a forest, usually a remote area, who probably don't have that many options. And for them, access to wild source protein is extremely important. So for these community members, I think maybe what we should be looking at as solutions are diversifying the options so that we don't have a single option, i.e. wild sourced meat or wild source protein, becoming the key long-term option. Because once that happens, we have a problem, once they are entirely dependent on that. Now, the second scenario is that of people who probably are better off to do economically, and for whom eating wild meat is a trend because they have access to other options, but they just want to do this because they feel like doing it. So for those people, I think part of the solution is raising their awareness about the risk factors, about the impacts of what they are doing and what that could mean, not only for their own health, but for others as well. And understanding that these trends drive huge demand curves, which then link up to other sectors, including illegality and issues of security that we are seeing in many areas. In many places, it is poaching and cross-border trafficking goes hand in hand with insecurity, with terrorists crossing borders into national parks, and so on. So helping people understand what the impacts are and trying to find solutions based on these different scenarios, I think might help us to find the solutions that best fit with the issues that we are dealing with. Thank you.
Thank you, Michael. Let me throw another great question out to the panel. Perhaps we can start with Laurel, and then whoever else wants to answer can jump in. One attendee is asking for recommendations on the best way to ensure these effective collaborations we've been talking about happen also in non-emergency periods. And I think this is a particularly important question because it really gets at the theme that we're trying to address today of really actionable information for implementing partners. So Laurel, if you want to maybe address that one first, and then whomever else can go next.
Yeah, that's a great question. And what I think I often see that things take on a life of their own. What might start in a crisis situation, partly because of relationships, and because once you've built a relationship, like, it's there, and you have that relationship, and so you'll end up calling on it, unless it's a really bad relationship, I guess. But you'll generally call on it when you need it, and so a lot of the energy that goes into creating this ends up sticking. But the other thing is that if it's effective, people want to keep doing it, and it keeps taking on a life of its own. I mean, I also think trying to maintain a discussion, so having some sort of way to capture some of those discussions, whether it's just housing an archive of communication somewhere so that it's accessible and you can draw on it. And the other thing is, by having a diversity of people within a group, you start to maintain a history. So trying to maintain, get people with experience as things progress, to maintain that history.
Thank you. I think we should also look at the fact that there are already institutions that are responsible for providing guidance on how we manage different aspects of our lives, our communities, at regional level, at global level. So they have a responsibility, as I said earlier, responsibility for making sure that the things we are doing during emergency periods get inserted into policies and laws, so that beyond the emergency period, they are mandatory. But we need to make sure there are vehicles that will carry these policies and the resources that are available. I think that's where the biggest challenge is. Do we have these vehicles? Do we have the resources? So much of our work has to go towards establishing these platforms and frameworks that can make sure the policies actually get implemented, not just in the emergency period, but even after the emergency periods.
Unfortunately, it's human nature to react to emergencies. Everyone gets involved. So that's one unfortunate aspect of just how we behave. But failing that, I think in certain situations, like I was talking about in Liberia, I think when you've sort of built a structure for something, and there's certain protocols in place or certain expectations in place between the different actors or the different entities that are involved, or the different individuals that are involved, then I think over some time building sort of that the relationships, like Laurel said, but also the expectation that your coworkers or your colleagues have, I think that can, and with a structure that's written like protocols or SOPs or whatever, that can then lead to continued action on the specific areas that you're working.
I do want to thank you all for joining us. This has been a really exciting conversation. I hope it's been helpful, and we hope it's the beginning of a longer conversation, an ongoing conversation that can really focus more attention on breaking down some of these silos and helping us to collaborate and coordinate across these sectors to reduce the risk of zoonotic transmission. Have a good day or a good night, depending on where you are. Thank you. Bye-bye.